Hi, Anatomy. This is Miss Satterley. I'm going to talk about the clavicle and the rib cage and sternum today, as well as the spine. The clavicle really should be talked about with the scapula because together that's called the pectoral girdle, but it's out of order in the bone book, so I'll talk about it now. It's not that big of a deal. This is the clavicle. The clavicle is another bone that we have two of in the body. You can actually see these on people usually if they are thinner, they really can pop out sometimes, but these are at the top of your chest. There are 6 structures that I want us to learn, and I'm going to talk about how we can remember what direction is what. So on the clavicle, there are 2 ends. There's an acromial end and a sternal end. Well, the sternal end is the end that's going to attach to the sternum, and that is actually this side, the flatter side. It is light blue on the clavicle itself. The acromial end actually is on the arm side or the shoulder side, and that's because there's also an acromion process on the scapula that will actually correlate with the acromial end of the clavicle. So again, the sternal end and the acromial end. Next one is just the main part of the clavicle is called the shaft. There's also a shaft on the femur. This portion right here that I have colored in, this is a type of tuberosity. Tuberosities always appear as rough patches or surfaces on the bones, and that's where muscles and ligaments and other things attach. This is the costal tuberosity. So we have the sternal end, we have the acromial end, and the costal tuberosity. There are 2 more structures that you'll have to label on your bone book itself, and that is the conoid tubercle, and that is colored in green right here, and there's a little knob on both sides. These are actually the same side clavicle, but I was trying to fake it there. But here it is, the conoid tubercle, and that's a little knob on the acromial end. And the last one, it's going to be labeled 4. It's actually it's representing this joint, sternoclavicular joint. Joints are usually named after the 2 bones that are articulated there. Sternoclavicular joint. So there's a top view. You can see the very top of the sternum is where the clavicle is going to articulate with. Let's go over the pictures here. This is the flat side, and this is the rounder side. So I know this is the acromial end. Right here is a little knob that I showed you, the conoid tubercle. This is actually labeled number 6 on your bone book itself. I changed the number because I accidentally had 2 3s. Number 6 is the shaft. Number 5, this is that rough surface, which is the tuberosity. In this case, it's the costal tuberosity. Number 3 is the flat end or the sternal end of the clavicle. And 4 is going to be that sternoclavicular joint. Next, I want to talk about the spine. So I have several vertebrae here that I'm going to talk about. You can see that they come in different shapes and sizes, and that's because they're in different parts of the spine itself. So the spine is separated into 3 sections. You have cervical vertebrae at the top, because remember, cervical is a body region for neck. And there are 7 cervical vertebrae. The next section is thoracic. Thoracic was with the rib cage. So these are the set of vertebrae that your ribs actually attach to. And there are 12 of those. And the last section is the lumbar. When we did body regions, we learned that lumbar was lower back, and there are 5 lumbar vertebrae. Now after that, we do have the sacrum and the coccyx, which are fused vertebrae, which do attach to the spine, but those will be in the video when I talk about the pelvis. I'm going to point out some things. so you can learn how to tell the difference between cervical, thoracic, and lumbar vertebra. This one I'm going to start with. This is a cervical vertebra. The reason I know this is one, it's small, but the biggest indication is the two vertebral foramina here, which all cervical vertebrae are actually going to have those two holes here. Now, in contrast with this one, now they're both smaller. You can tell they're different shapes. This is a thoracic vertebrae. It does not have those foramina there. It's missing that, so I know, okay, these are not the same type. This is a thoracic vertebrae. The structures on this vertebrae have two processes, a spinous process and a transverse process. Now, the spinous process is what you might see if someone is very thin. Sometimes you can see their spine. And that's because these spinous process will actually poke through the skin, and you can observe that on some people. So this is a spinous process right here, and this is a spinous process. Now they look a little different, but they're the same type. The other one is transverse process, and vertebrae are actually going to have two, and that's these two structures right here, transverse process. So this is a thoracic vertebra, which is the one of the 12 where your ribs attach. And I know that because of the very large transverse processes here. Now, if I go back to the cervical vertebrae, I can see my transverse process are not very big. This is the lumbar. You can see here's the spinous process and then the two transverse process. Not as big as the thoracic, so you can definitely tell the difference between the two. This is called the centrum, which is the body of the vertebra itself, centrum. So don't put body. I want you to put centrum. We're using technical words. If I look at my vertebra here, this right here, this indentation on both sides, those are called vertebral arch. There are two types, articular process. An articular process is where an articulation is, and that's a joint. And we have a superior articular process and an inferior articular process. So this is a thoracic vertebrae, and this is also a thoracic. These two don't really line up because they're not right next to each other, but they do fit like this if they were the right ones. So articular process is where the vertebrae are going to meet. So this one right here is a superior. It's on the top. So it actually goes like this. Okay. Superior articular process. I'm going to put this back on. And then when they meet on the bottom side, that's the inferior articular process, which you can see right here. They're both flat looking, and that's because that's where the two bones are going to meet. These are not the thoracic vertebrae that go together. You can see by the size of the centrum, but it'll do the job here to show you what that is. Now, if you look in between, there's a hole right here. That's an intervertebral foramen. Intervertebral foramen, because it's in between the vertebra. This is an intercalated disc. This is what representation of the cartilage that you have in between your vertebrae. This is made of fibrocartilage. So when we talked about tissues, so it would lay here, and then your next vertebrae would be like this, and that's how the spine is comprised. Now this allows for compression. It allows for stability. So intervertebral disc is what that is. Now we have two special vertebrae that have their own unique names. They're actually C1 and C2. It's called the atlas, which is this one right here. This is actually C1, or your first cervical vertebrae. And then this is C2, which is called the axis. Now on the axis, you can see there's this very prominent knob. This is called the dens. And that is actually how it fits like this. It allows your atlas to rotate. Now these two surfaces right here actually are going to articulate with the skull. Your skull is going to rest on these right here. So again, atlas, axis, dens. And if I look at both of these, I notice that they have two foramina on the structure. Now that I've showed you what the structures are on the bones itself, let's look at our picture. So A, B, and C are not in our bone book. You might want to add that though, just so you have it. But this is cervical vertebrae, which we should know because of our body regions: neck, thoracic, this rib cage, and lumbar, low back. Now these are all little sections. This is actually all of the cervical vertebrae here. One is pointing at the dens. The dens, again, that's the knob on the axis, the knob. 2 is pointing at that top cervical vertebrae, which is the atlas. 3 is pointing at the axis. 4 is the transverse process. Those are the two on the sides. 5 is the spinous process that makes up the visible spine on some individuals. Number 6 is the intervertebral foramen. Number 7 is pointing at that intercalated disc. 8 and 11 are the superior articular process and the inferior articular process. Number 9 is pointing at the centrum or the body, so I want you to put centrum. 10 I forgot to talk about on the bone, but it's called the demifacet. And the last one, 12, is that vertebral arch. Last thing for this video today is we're going to talk about the anatomy of the sternum and the rib cage. Here's the sternum. The sternum is also called the breastplate. It's at the very front. You can feel your sternum. It's a very hard plate. It helps protect your parts of your lung, your trachea, esophagus, and other structures like that. There are a couple structures on here that we need to learn. One, there's this notch up here. This is called the jugular notch. This is actually where the jugular vein is going to run through. And then it also goes through the jugular foramen in the skull, jugular notch. This top part, you can see there's a suture right here. It separates the sternum into two major parts. This is called the manubrium, and this one down here, this is called the body. Now down at the very bottom, there is this process here. This is the xiphoid process. Now you can see that we have cartilage that attaches to the sternum itself. This is where the ribs are going to attach. Your vertebral sternal ribs attach on these first ribs because they're actually attaching to the bone itself, vertebral sternal, which we call those true ribs. Now down here, we have other structures where ribs are going to attach to the costal cartilage only, and those are vertebral chondral ribs. Here are ribs themselves. So the smaller one at the top, this is actually a true rib. This is going to be more at the top. They're labeled, this is L3, so this is the third rib on the left side of the body. So vertebral sternal rib. This is vertebral chondral rib. This is the part of the rib cage that's a little more, it's larger. It needs a little more flexibility and stuff. So this is actually R7. So vertebral chondral. And last with ribs, we actually have these guys. These are called floating ribs. These are going to attach at the very bottom of the thoracic vertebrae, and they are not attached to cartilage. They're just there, attached to the spine itself, but not reinforced in the rib cage like the other ribs are. So again, floating ribs, vertebral chondral rib, which means it attaches down here, and then we have vertebral sternal, which is going to attach directly to the sternum itself. Now, last picture for today's video is the rib cage. Number 1 is pointing at the top, which is that jugular notch. Number 2, this is the clavicular articulation, so that's where the clavicle meets the sternum. Number 3 is pointing at the top, the manubrium. Number 4 is actually pointing at the entire sternum itself. 5 is this right here, which is the body. 6 is that xiphoid process, and in this picture you can see it also has some cartilage attached to it. 7 is pointing at that costal cartilage, which attaches to the sternum and the ribs, forming a connection. This is important because it allows some flexibility in the rib cage. So when you breathe in and out, your rib cage is going to expand and contract, and that costal cartilage there is what allows that to happen. So it allows your lungs to fill up with air. Then we have our 3 types of ribs on this side. These little guys down here are the floating ribs. There's 2 sets. Next one, these are attached directly to the cartilage, so I know that these are vertebral chondral ribs. Then the number 10, these ribs are attached directly to the sternum or the bone, so these are vertebral sternal ribs, which we call true ribs, false ribs, and lastly, floating ribs. Have a wonderful day. Bye.